Okay, we're away. So I'll probably start with. So how did you guys go about choosing where you were going to apply? You have 4 choices. How did you go about it?
So the first time round, because I took a gap year, the first time I had to choose, I chose because I'd been to the universities and I liked the course and and then the different. Some of them had the integration of PBL. One of the universities had the choice of an integrated BSc. So I like the area and the course structure. So that's why I'd like to.
Okay, sure. Mm-hmm. What were the thought processes that you had?
I wanted to make sure I played to my strengths because medicine's so competitive and you've only got 4 choices. So I wanted to try and guarantee 4 interviews. So I ended up then applying to 2 BMAT and 2 UK CAT. I applied to only 2 UK CAT because my UK CAT wasn't bad, but it was only just above the average. So in order to maximise my chance of interviews, I thought, let me try BMAT and perhaps I can have a better shot at that.
Sure.
And I also looked at what unis look quite heavily on GCSEs because for me that was my strength, and also personal statement.
Sure. So the thing about BMAT is because it's set in November conventionally, that means that you'll be going in cold. You apply in October rather. So when it comes round to November, you won't know how well you'll do in the BMAT. So don't put down as a general rule more than 2 BMAT universities because you just don't know. You might oscillate and you might just have 2 places left which are viable rather than 4.
I mean, because generally I would only recommend applying to 1, but I thought I'll take the risk just because to maximise my chances. And it paid off in the end, but it's definitely a risk to bear in mind.
And a lot of people have put off applying to a BMAT university just because it's an extra aptitude test, it's an extra bit of hassle. But it isn't that much in the way of a hassle. Normally you have a half-term holiday just before it. You can sit down for a week, do all the past papers, do all the practice you need to, find the right resources, and you can do well if you put your mind to it. So at the end of the day, don't be put off.
Mm-hmm. Yeah. I only started revising for it once I submitted my personal statement anyway, and I still found that was enough time in order to get the score that I needed to get an interview.
Sure. So those are more sort of based on our strengths. What about more general things about the town, the city, whether we had any inclinations about where we wanted to go to before we applied? So I kind of had the idea that I wanted to go to Cambridge before I applied. I liked the sound, the way that the course sounded because there was quite a clear distinction between the clinical science element and the hard theory element. So I thought that sounds attractive to me. It seems like quite a good transition from where I am now studying for my A-levels. So that appealed to me. That's why I applied. And I had to sort of work my application around that because I had 1 BMAT university, Cambridge, that I wanted to apply to. I could only pick 1 other. So did any of you guys have any inclinations about where you wanted to apply before?
Yeah, so I made sure that I went to the open days before actually applying to the uni. That way I could have a feel of the city and actually properly know what their course is like. And I was attracted a lot to unis like Imperial and UCL because of their course structure, and also they were both city. I know a lot of people like campus, but I'm someone to like city a bit more. And I also loved Bristol as a city as well. So that's what made me apply to those 3. And I liked how Imperial and UCL, they had a very integrated style of teaching. I think UCL is a bit more on the traditional side. Both are actually quite traditional in their way of teaching. So traditional means generally the first 2 years are just full of theory and the rest of the course is clinical. You've got placements in different places and you've also got a BSc. That's one thing which I considered because I want to do a BSc. So Bristol, you've got the option of having a BSc, and Nottingham is where I also applied, and they do half a year of sort of like a BSc. It's a bit different, but it's essentially almost the same thing. And for me, that was important because I did want to do something like that because it's a year where you can just do your own type of research.
Yeah, I think it's interesting how all unis offer different things. So it's important to go there and see, if you like the feel of it and the kind of course and the kind of options that they're offering. And and if you like it, then apply there.
So integrated is basically where they mix sort of having a very traditional style and then also a very clinical way of teaching. So you've got a lot of lectures, but then you also sometimes go to the GP surgery or hospital for placements, or you can do like different types of teaching like PBL, which is problem-based learning. And there's also something called case-based learning, which is what Bristol uses, but that's very, very similar to problem-based learning. And that's basically where you're in like small tutorial groups and you look at a case and you talk about it, and it's a lot more self-teaching, whereas lectures you kind of get given what you need to learn. I have to say that integrated styles of teaching often is more traditional than the clinical side or the PBL style. But I liked how they did have that small variation. It just added something. Is Oxford and Cambridge like purely traditional?
Yeah, so the thing about Oxford and Cambridge is you will not see a patient, by and large, you will not see, a white coat or a stethoscope for the first 3 years, by and large. There are some clinical elements to the course, a couple of shoehorned in, pseudo-clinical things, but by and large, you will be doing a medical sciences degree, by and large, at least for the first 2 years. With Oxford, there's a bit more structure to your third year, so you have to do something pertaining to pharmacology or biochemistry or physiology or something. With Cambridge, you can do pretty much whatever you like in your third year. So that's something that appealed to me when it came to Cambridge, as opposed to Oxford. So when I say you can do whatever you want when it comes to the third year in Cambridge, I mean a lot of people tend to opt for things like physiology and biochemistry because they're still relevant and they get to. So another thing that people tend to think about when they're choosing where they apply is that somehow or other the published competition ratios for different universities are out there floating about on the internet. So from that you can see some trends. For example, universities like Kiel, which don't have quite as much in the way of stringent academic qualifications, tend to be oversubscribed. So if you're applying to plenty of those universities because maybe you're a bit concerned about whether your academic aptitude, or at least your qualifications are up to the mark, then you have to sort of be careful about how many you apply to, because there's a big difference between applying to 4 schools which have a 1 in 8 ratio as opposed to 4 schools with a 1 in 15 ratio.
Yeah, I think definitely that's where like going to an open day is pretty useful, because often the admissions tutors are there and then they can tell you exactly what they're looking for. And then if you do think that you like tick all the boxes and quite to a good standard as well, I think that's where then you should ignore the statistics and kind of just believe in yourself and apply.